What did you find, doctor, at the outset? At the outset, I found behavioral disorders. And was that a mental deterioration, doctor? Well, it was myoclonic jerkings and convulsive sutures, or seizures rather, as the disease progresses. Was there stupor? Yes, there was stupor, dementia, rigidity, blindness, and coma in the terminal phase. Doctor, did you find any tabes dorsalis? Yes, tabes dorsalis, and locomotor ataxia, which is a syphilis of the central nervous system clinically recognized by peculiar gait. Doctor, was there a carotid artery ligation done? Well, tying a carotid artery in its cervical portion or neck, or using a Silverstone or Crutchfield clamp to gradually occlude the blood flow in the extracranial portions of the common or internal carotid artery was the procedure I employed. Doctor, what is carotid endarterectomy? Carotid endarterectomy is a removal of plaques or the intimal lining of a carotid artery in occlusive cerebrovascular disease. Doctor, does this removal carry out the carotid bifurcation? Well, I am not so sure what your question is implying, but it is followed by a reconstruction of an internal carotid artery with a Teflor graft. Doctor, that is a carotid reconstruction operation, is it not? Well, it is the repair of the carotid artery with a graft or bypass. Doctor, what is a cingulomotomy? A cingulum destruction by stereotaxic surgery with positioning of the electrodes in the target area. Doctor, is the operation done under radiographic guidance? That is correct. It is for relief of psychogenic pain, manic depressive reactions, and other disorders. Doctor, what about a cordectomy? A cordectomy is the removal of a portion of the spinal cord to convert a spastic paraplegia to a flaccid paraplegia. This enhances rehabilitation. And doctor, a chordotomy? A chordotomy is a section of a nerve fiber tract, usually the spinothalamic tract within the cord, for relief of pain. Doctor, is there such a thing as a percutaneous cardotomy? Yes, a percutaneous cardotomy is a surgical interruption of the pain fibers in the high cervical cord by means of percutaneous electrical needle. This is done under biplane radiographic control. And doctor, is that also called a selective chordotomy? No, it is a palliative surgery for obtaining sensory loss in local pain regions, as in the arm, leg, or trunk. And a craniectomy, doctor? Well, that is the removal of a part of the skull bone, a method of approach to the brain. Doctor, what is a craniotomy? A craniotomy is an opening of the skull. The burr or trephine openings into the skull are made in order to prepare a bone flap. This osteoplastic flap is separated from the skull during brain surgery and replaced when the skull is closed. Osteoplastic craniotomy is a common method of approach to the brain. Doctor, cryoneurosurgery is what? Cryo-neurosurgery is the operative use of cold in the destruction of neurosurgical lesions and the decompression necessary. Is that technical enough? Good forms of medical. Would use them. Not much help.